Hi, Dr. Alyssa Dweck here, Chief Medical Officer at Bonafide. Today I wanted to highlight a study that was recently presented at the Menopause Society just last week. This study focused on a syndrome called genitourinary syndrome of menopause, or GSM. This is a collection of symptoms: dryness, irritation, burning, pain during intercourse, and even urinary complaints related to low estrogen. The study that was conducted was independent and done at NYU Langone, the School of Medicine. This study was a randomized study, the gold standard type of study, involving postmenopausal women who were diagnosed with GSM. Half of the women were randomized to take Revaree, 5 milligrams of an over-the-counter hyaluronic acid insert meant for vaginal use, and the other half of the women were given the gold standard treatment for vaginal dryness, or GSM, which is a vaginal estrogen insert or cream. The study found that there were comparable results amongst both groups. There also were no side effects that were truly adverse noted in either group. The reports suggested that women's diaries, as well as scientifically validated questionnaires, were equivalent, including vaginal pH, in both groups. So why is this study so important? Well, GSM causes a lot of distress for a great majority of women in the perimenopausal or menopausal states. Many women choose not to or are unable to take estrogen products, and therefore it's so important that we have a comparable alternative. This study really supports that vaginal HLA, hyaluronic acid inserts, are comparable to estrogen and can be considered a very viable and promising alternative for both consumers, patients, and healthcare providers to keep in mind. It's also important to note that Bonafide as a company is committed to doing scientific studies on all of its products coming down the pipeline, because this is super important really to support safety.